Hello, and welcome to Section 1 on Early Childhood Development and Developmental Milestones. Let's talk about early childhood development. Childhood development refers to how a child becomes able to do more complex things as they get older. This includes physical, mental, social, and emotional development. Developmental milestones are a set of skills or tasks that most children can do at a certain age, such as crawling, talking, and walking. Skills such as taking the first step, smiling for the first time, and waving bye-bye are called developmental milestones. Children reach milestones in how they play, learn, speak, act, and move. For example, by the age of 2 years, your child should be able to point and look at things when they are mentioned, and should be using sentences of 2 to 4 words. If a child is not able to do this, it raises some concerns and red flags. We'll go into more detail on specific milestones by age a little bit later. There are 3 levels of tracking and measuring your child's developmental progress, each level being more structured than the one before it. The levels are developmental monitoring, developmental screening, and developmental evaluations. Let's talk first about level 1, developmental monitoring. When you keep track of how your child is progressing on milestones, it's called developmental monitoring. It is very important for you to do this. You observe how your child grows and the changes over time, and whether your child meets the typical developmental milestones in playing, learning, speaking, moving, and behaving. Parents, grandparents, early childhood providers, and other caregivers can participate in developmental monitoring. You will use a brief checklist of milestones to see how your child is developing. If you notice that your child is not meeting milestones, talk with your doctor or nurse about your concerns. Although each milestone has an age level, the actual age when a normally developing child reaches that milestone can vary quite a bit. Every child is unique. However, there are also very clear guidelines that doctors have developed that all children should be following. Note, slide 5, new table, NVO to be inserted. Coming up to slide 6. The table we just reviewed is only a small sample of the milestones you should be tracking for your child. In fact, there are specific milestones you should be tracking from as early as 2 months. Milestones are defined for 2 months, 4 months, 6 months, 9 months, 1 year, 18 months, 2 years, 3 years, 4 years, and 5 years. The cdc.gov website in the Child Development section is an excellent resource for learning more about developmental milestones. The cdc.gov website has some great resources, including a free milestone tracker mobile app, a free downloadable checklist of milestones to see how your little one is developing, and a library of photos and videos showing developmental milestones. Now, we've discussed developmental monitoring. Now let's talk about developmental screening or screening. Developmental screening takes a closer look at how your child is developing. Your child will get a brief test, or you can complete a questionnaire about your child yourself. These tools are available online for you to use at no cost. The tools used for screening are questionnaires or checklists that have been developed by doctors. They are based on scientific research that asks questions about a child's development, including language, movement, thinking, behavior, and emotions. Developmental screening can be done by a doctor or a nurse, but also by other professionals in healthcare, early childhood education, community, or school teachers. You can complete the screening tools yourself to gauge how your kiddo is doing. Developmental screening is more formal than developmental monitoring and normally done less often than developmental monitoring. Your child should be screened if you or your doctor have a concern. However, developmental screening is a regular part of well child visits for all children, even if there is not a known concern. The American Academy of Pediatrics, or the AAP, the group that sets standards and guidelines for doctors who specialize in treating children, has set a standard for doctors that developmental screening for all children should be done during regular well child visits at these ages: 9 months, 18 months, and 30 months. In addition, the AAP recommends that all children be screened specifically for autism during regular well child visits at 18 and 24 months. If your child is at a higher risk for developmental problems due to preterm birth, low birth weight, environmental risks like lead exposure or other factors, your doctor or nurse may also discuss additional screening. If your child has an existing, long-lasting health problem or diagnosed condition, they should still have developmental monitoring and screening in all areas of development, just like those without special healthcare needs. If your child's healthcare provider does not periodically check your child with developmental screening tests, you should politely insist that it be done. As a parent or caregiver, it's very important for you to understand what you should expect from your pediatrician or healthcare provider when it comes to screening for autism. You are your child's advocate. As mentioned earlier, the American Academy of Pediatrics recommends that all children receive screening for autism at their 18 and 24-month well visits. These screenings are a preventative health service and are covered by virtually all insurance plans, including Medicaid. The guidelines for which children should get screened are crystal clear. All children should be screened. It's unambiguous. Despite what some people may tell you, even including some healthcare providers and pediatricians, the American Academy of Pediatrics recommendations are crystal clear. All children should receive screening, no exceptions. Let's hear from Dr. Michael Kelly, a highly recognized expert in childhood development, on exactly why this time period in infants and toddlers is so crucial to monitor. Dr. Kelly explained why early childhood development years are so crucial and why intervention is so important. For screening, most doctors or nurses use the MCHAT, a short questionnaire filled out by parents that most families find easy to complete. As a parent, you can also complete the MCHAT. It's available for free online at m-chat.org. Using the MCHAT screening tool, a child's risk for autism can be checked, which will prompt follow-up conversations about monitoring your child's development, as well as possible next steps, which may include a formal diagnostic test. Remember, you can access a free online version of the MCHAT at m-chat.org. I cannot overemphasize the importance of developmental screening in children. Studies show screenings are accurate, and research shows treating children early for autism can help mitigate its effects. Screening can identify at-risk children early when they will benefit the most from treatment and intervention. Please remember, All children should be screened for risk, not just those with symptoms or concerns. As a parent myself, I understand that it can be overwhelming to sort through all the information and advice you receive about healthcare for your child. So please be aware that screening isn't the same thing as diagnosis. Screening occurs prior to an evaluation or diagnosis. And just because your child has a positive screen for autism does not mean that he or she will actually be diagnosed with autism. Please remember, the information in this program is not meant to diagnose or treat. It should not take the place of a consultation with a qualified healthcare professional.